Welcome back to the Golden Canopy Health Management channel, where we're dedicated to ensuring health, enriching life, and embracing retirement. My name is Kevin Lee, and today we're going to be talking about a topic that's a little confusing, which is Medicare versus Medicaid. A few people have reached out to me and asked me to create a video that explains the difference between the two. And it's my pleasure to do so. If ever you have any requests to see a topic or to have a video about a topic, please don't request to either reach out to us by phone, 720-927-6891, or you can leave us a comment and we will create a video for you. So once again, today's topic is Medicare versus Medicaid. So those are two very different programs and they serve two very different groups of people. So today we're gonna, dive into this bowl of spaghetti to hopefully untangle it all for you. Hopefully when it's all said and done, you guys will be able to know and understand the difference between Medicare and Medicaid. So they may sound the same, but they are apples and oranges. So let's dive in. So first, let's talk about Medicare, the big M. So Medicare is a federal insurance program that is mainly for and mainly covers people 65 and up. So if you're turning 65 or you are already 65 or older and you're already in the retirement golden years, Medicare is your best friend. And of course, folks under 65 can qualify for Medicare as well, assuming they have certain illnesses and disabilities, as well as end-stage renal disease. No matter your age, if you have end-stage renal disease, if you have certain disabilities, certain illnesses, you would qualify for Medicare. Now, what does Medicare actually cover? Well, I've created a couple videos for you guys to unpack that and understand it more. But basically, Medicare has four parts because we like to make things complicated. Luckily for you guys here at Golden Canopy, we can take what most people find overwhelming and confusing and complex and make it super simple for you to understand all your options and all your plans. So Medicare covers four parts. Part A, of course, is your big ticket expenses, things like hospital visits, nursing care facility, and even some home health care. Then there's Part B, which is your everyday expenses, like needing doctor's visit, outpatient care, as well as preventative services. And Part C, also known as Medicare Advantage, is like a fancy package deal that bundles Part A, Part B, and some extra perks, sometimes having vision, dental, hearing, gym memberships, as well as Part D prescription drug coverage, because no one wants to pay full price for healthcare if they don't have to. So now let's talk about Medicaid. Now Medicaid, I want you to think of it as Medicare's younger sibling who's significantly more generous, but only if you meet a certain requirement. So Medicaid is a joint federal and state program that helps people with low income and limited resources. So if you're in need of healthcare but can't afford it, then Medicaid's got your back. But unlike Medicare, which is generally the same across the US, Medicaid can be a bit of a conundrum because it changes based on where you live. By that, I mean each state runs their own Medicaid program. So if you live in Texas, or if you live in California, or Florida, or Missouri, they are different compared to where you live. So a Texas Medicaid plan is not the same as a Missouri Medicaid plan, because like I said, they're all ran by their state. So that being said, Medicaid does cover a little bit more than Medicare. Things like long-term care and personal care services will be covered under Medicaid, but not Medicare. So let's break down who qualifies for each program, because remember, Medicare and Medicaid, two different programs that serve two different groups of people. So let's talk about who qualifies for who. So with Medicare, it's pretty straightforward, folks. If you're 65 or you're turning 65 or you're older than 65, Medicare is for you. You're in, you got it. Now, if you're under 65, of course, if you have certain disabilities, you might also qualify for Medicare. Now, Medicaid, on the other hand, is a little bit like trying to join an exclusive club. Now, you need to meet certain requirements and have certain resource and income limits. Basically, the main question Medicare is going to ask is, how much money do you have? If your answer is not much, you could be eligible. So what do these programs cover, right? So Medicare, as we talked about, handles the basic hospital stays like doctor's visits and some prescription. But here's where it gets fun. Medicaid covers a lot of the same things as Medicare. Think dental, vision, and even long-term care services. Medicaid is like your friend who brings stuff to the party, but that friend is not just concerned about having the drinks covered, but they bring the drinks, they bring the cups, they bring the ice. They want to make sure you're covered well, and that's the function of Medicare for those who meet those income and limit resources, who just don't have the income and resources needed to be able to take care of their health solely on Medicare. But if someone is eligible for Medicare, they're turning 65, chances are they're also eligible for Medicaid, and we call that dual eligible. And if someone is eligible for Medicare and eligible for Medicaid, they have hit the jackpot in terms of healthcare needs. The gaps that Medicare covers, because Medicare does have a premium for it, Medicaid will swoop in and cover that premium for the Medicare. So let's talk a little bit more about money, right? Medicare isn't free. It's like a subscription service with premiums, deductibles, and copays. So you're paying for the peace of mind that you get by having Medicare to cover your health when you turn 65. So Medicaid, on the other hand, can cover those premiums, like I said earlier, and really pick up the gap where Medicare leaves off, Medicaid can pick up. So the bottom line is, if you're 65 or have qualifying disability, Medicare is your go-to. It's reliable, it's run by the federal government, and it's there when you need it. But if you're struggling financially, Medicaid might be your hero to your story, swooping in to cover those gaps that Medicare leaves behind. And remember, if you're lucky enough to qualify for both, you're in healthcare heaven, right? So that's how we discuss and we discover, distinguish between Medicare and Medicaid. Medicare is a state and federal ran program that is designed and tailored to really help seniors with limited resources, financial, to take care of their health. Whereas Medicare is eligible to anyone turning 65. And if you do need a little bit more help, you can apply for Medicaid. You do Medicare through your federal government, you can call Golden Canopy and we can help you sign up for your Medicare plan. If you want to know if you qualify for Medicaid, you can also reach out to Golden Canopy and we can help you see if you qualify for Medicaid as well. And if you're eligible for both, like I said, that is healthcare heaven. That's it for today as a deep dive between Medicare and Medicaid. I hope you found this helpful. Make sure to share, like, subscribe to the Golden Canopy Health Management channel for more relevant information. And if you have a topic you guys want to learn more about, please don't hesitate to comment, reach out, and let us know what topics you want us to cover for you. I really enjoy doing these for the senior community. It is a passion of mine to make sure that seniors do get in the right plan that makes the most sense for them. You can reach out to Golden Canopy Health Mgt, and any one of our health managers will assist you. The phone number is 720 area code 927-6891. You can also visit our website at goldencanopyhealthmgt.com. And you can also shoot me an email at kevinlee@goldencanopyhealth.com. Thanks so much for watching this episode on Medicare versus Medicaid. Enjoy the rest of your day, and see you next video. Bye-bye.